cher Dr Marcus, je vais vous poser une ou deux petites questions pour cette interview. Donc, je vais vous demander, une fois que le diagnostic médical est posé, pouvez-vous nous donner, on pourrait dire, les meilleures indications de ce type de traitement spécifique par EMDR intégré pour les patients souffrant de migraine et de céphalée, qu'elles soient aiguës ou bien sûr chroniques?
Diagnosis is made. There's two parts to integrated EMDR. Phase 1 is to treat an acute migraine. Phase 2 is working multiple sessions to help people prevent migraines in the future. Okay. Phase 1 for acute migraine, there's three parts. There is some breathing, there is some head compression, and there's some EMDR, eye movement desensitization and reprocessing. And the combination of those three elements creates a synergy, and the migraine goes away. The research that we've done, we have randomized controlled study that shows 62% of the people, their migraine goes away, severe migraine goes away in 28 minutes. Okay? And for people, some people, it might take a little longer, 30, 35 minutes, maybe 40, then the migraine goes to zero. No side effects.
Ok, bien sûr, je vous remercie. Question qui intéressera évidemment beaucoup de monde. Approximativement, bien sûr, combien de séances sont nécessaires pour en être libéré, car comme vous l'avez dit, je m'aperçois qu'il y a un effet sur, bien sûr, la neurophysiologie au niveau du corps, et donc bien sûr nos patients seront intéressés.
Okay, pause. All right. So usually a treatment takes anywhere from 22 minutes to maybe 45 minutes. That's for an acute migraine. And in most cases, that migraine is eliminated. It's gone. But that's just one migraine. Some people have 1 or 2 migraines a month, so they may need a phase 2 treatment, which helps them change or alter their migraine memory network so they no longer, or there's a reduced amount of migraines in the future. Reduced migraine, fewer migraines, more time between migraines. And that's what we call stable recovery. Now, I'd also mention that there's a difference between adults and children. Children respond very quickly to this treatment. Could be 15 minutes, 20 minutes, and after they've had several treatments, it may only take 10 or 12 minutes to get rid of their migraine.
Bien, je vous remercie, et ma collègue Françoise a bien sûr une petite question à vous poser.
Docteur Marcus, peut-on traiter par la méthode EMDR intégrée tout en continuant son traitement médical habituel?
Yes. Integrated EMDR works well with other treatments. So if somebody is seeing a neurologist or a medical doctor and they're receiving medication, that's fine. Because if they're away on holiday or they're in another city, they may need their medication. But if they're local, then they can come see a practitioner of integrated EMDR. They can see Bernard or Françoise, and they can get their headache treated right then. The caveat with medication is it must be taken early. It must be taken in the first 30 minutes when you get a headache. And that way it stops the headache from developing. Headache, if you have a headache for 2 hours or 3 hours and then take the medication, it doesn't work as well. With integrated EMDR, if a headache has been ongoing for 2-3 hours, you can apply integrated EMDR and eliminate or greatly reduce the headache. So these two treatments work very well together.
Bon, merci merci Dr Marcus pour toutes ces explications brèves mais précises, et puis aussi bien sûr au nom des professionnels français de la santé que vous formez en France et bien sûr dans les pays francophones, car je sais que vous allez partout à travers l'Europe. Et puis aussi, bien sûr, pour les professionnels français, Françoise Pascalin, ma collègue, et moi, Bernard Meyer, nous avons une liste, comme il y a une liste aux États-Unis, de praticiens formés à cette thérapeutique très spécifique. Voilà, je vous remercie beaucoup.
So, I want to thank Françoise and Bernard and IETSP for inviting me to France, because here we are training physicians and psychologists in how to treat headaches in their office very rapidly. And we've done these trainings all over Europe. We've had 3 trainings in the Netherlands, we've had 2 in Germany, we've had another one here in France, we've trained in Israel, Turkey, Belgium,
America,
United States, Canada, all these countries, and we're developing a network of clinicians who can treat headaches very rapidly. And so in France, we'd like to develop a network or a list so that if someone has a headache in France, in Alsace, or Paris, or Cannes, they could get treated in that area.
Merci beaucoup de notre part d'être venu, et puis bien sûr à votre prochaine formation pour les professionnels français. Merci beaucoup.
Merci.
Merci.